teaching the hair angle orientation. The second part of this training is on photographs. What I do, I take a photograph and then we play with the idea. Everybody will get a printout of the photograph, and then the assistant will draw the line through the photograph and imagine where the cut would happen. The idea is to cut one row of hairs. It's called sliver. Marianne will explain this in detail in the next presentation. This is just the introduction in a pre-patient training. The same thing, hair grows in clusters. As you can see, there are clusters in the first photograph on the left. I drew the line to show how I would separate the clusters. There will be 4 follicular units on the top. On the right side, I show that they could be isolated as single follicular units, or they can be kept together as an individual graft, and they're called defollicular units. Critical thinking is, in my opinion, very important. How can I provide a quality if I don't know what I'm looking for? So we talk about gentle manipulation. So it's a delicate work. The other thing we talk about is that the grafts have to be hydrated. They also have to look good in a certain shape. We'll discuss that more in a phase 2 training, but this is just first introduction. So the more person hears about the quality, the more quality becomes something to look for. And then poor quality graft, I always show, and I will show you now, there is grafts on the upper row that they are transected, they're not acceptable grafts, and then we make a comparison with the clean grafts. Like you can see the hair shaft is transected, and that is not acceptable graft. We also talk about graft viability. If the graft is left to dry out, it doesn't have as high chances of surviving. So on the left, far left, is a hydrated graft. It has a luster, there's a little glossy look to it, and in the middle is dried out. It's made that there's no gloss anymore, and the far right is dry and transected. So once again, for quality, I have to show what is good and what is bad for someone to know how to strive for the good. And at the end of my pre-patient training, what I do is I play a little kind of test game where I give this image with terrible grafts, and then I say, what can you do about it? And so the person will think, take a pen and design where the cut would happen, and how many grafts can we make. The first one, none, because the grafts are transected. I don't even know if I can use this pointer. Oh, I'm sorry, I can't show you. I'm sorry? Oh. Okay, good. So this one, I hope you can see, the grafts hairs are transected, so they're not viable hair shafts, so I can't consider this as a good graft. The second one, I would make a cut on the side. What I'm going to do, I'll kind of go back to this one. There's an extra tissue, so we're going to dissect the tissue here. This one, I would dissect the tissue on the right, and these 2 hairs have viable hair shaft. I'll keep them that way, so I'll give you back the picture without the line. You see there's extra tissue we want to dissect from there. This one I would divide in 2. There would be 1 hair graft on one side, 2 hair graft on the other side. This one would be dissected on the right. This is questionable. I don't know what is on the other side. It doesn't look like there's a straight hair shaft that I can preserve as a viable graft. This one I will dissect the bottom portion. I'll go back to the picture. You'll see there's a little hair cut halfway to the top, and so I will dissect that out and keep this as a clean graft. Do the same thing here, dissect this and discard this, and dissect this and discard this part and discard this part. And so this is what this picture shows. So why phase 1 training? The objective was to expedite the training period. Remember, it may take much longer because someone starting practice doesn't have enough patience to practice. So practicing on a foam gives the opportunity to a person to develop hand movement, start thinking, understanding, graft dissection, body position. Also we talk about procedure, techniques, quality. So there is the base of hair transplantation assisting that happens during this phase. And then someone develops stamina and skill during the practice, and the other would be to decrease stress during the learning process because the person can ask questions. I will demonstrate the foam cutting.